my name is Simone. I'm a dental hygienist and I've been practicing for 16 years now. I wanted to give you a tip on how you can whiten your teeth for just $1. So get a bottle of peroxide from the dollar store and you can either rinse with it or you can dip your brush in it, brush it all around your teeth. The advantage to doing the brushing around your teeth is that you expose less of your tissue to the peroxide, which could potentially sting or burn. If you experience that, you can also just dilute the peroxide a little bit with some water. The more you dilute it, the less effective it will be, so it's up to you. It doesn't really matter how long you brush it on or rinse with it, but what does matter is that you leave it on your teeth for about 20-30 minutes without rinsing, eating anything, or drinking. And you should notice a slight change every day for just $1. Whitening toothpaste containing peroxide can be a great way to whiten your teeth. It's minimal effort. You're usually using toothpaste twice a day anyways. Minimal cost. It's usually going to be under $10. And hopefully minimal sensitivity since you are exposing your teeth to a low dose of peroxide every day. So you want to take a tube of toothpaste or the box and flip it over, look at the back at the inactive ingredients and look for something that says sodium carbonate peroxide or hydrogen peroxide. Those ingredients will actually whiten your enamel. If it doesn't have those, then it's just going to be a stain remover, not a whitener. You can also make your own toothpaste if you desire to do so. Just add some baking soda, peroxide, maybe some peppermint essential oil and some coconut oil, and good luck getting those teeth pearly white. Whitening rinses you find in the store, like your Colgate Optic White or Listerine Whitening, will actually whiten your teeth. They contain about a 3% hydrogen peroxide solution, so it's low dose. You should not really experience sensitivity, but if you do, or you get that whitish tissue buildup that sometimes people will get when using peroxide, just discontinue use. That's not for you. Or you can use an oxygenated rinse like my favorite, TheraBreath. Rinsing is not the quickest way to achieve whitening results. It's low dose, but it is inexpensive and convenient. You also get the added benefit of just rinsing, so you're cleaning debris out of your teeth, and if you gargle, cleaning debris out of your tonsils, freshening your breath. You can make your own, which is great because you can up the concentration of peroxide and maybe get quicker whitening results, and add essential oils if you want flavor. Having sensitive teeth is no fun and can be particularly frustrating when you want to whiten. So what could be some potential causes for your sensitive teeth? Could be poor oral health. You may need to just brush and floss and water pick better. It could be your general health. You could be taking a medication that's drying your mouth out, or maybe you have a condition like acid reflux that's making your pH level more acidic. It could be habitual. You might be taking your stress out on your teeth by clenching and grinding, or possibly brushing too aggressively and causing recession. It could also be your diet. Are you consuming a lot of sugars and acids as far as food, beverages, citrus, things like that? Thank you, my love. I like this balloonie. So these are just possible reasons that your teeth could be more sensitive. Stay tuned. I'll go over some possible solutions. If you want to whiten your teeth but they're sensitive, try picking up something called MI Paste 1. It will help to desensitize your teeth and also remineralize them. So if you have white spots on your teeth, it may help build those up and get them a more normal, consistent shade with the rest of your teeth. And it also helps with dry mouth. So if you don't want to commit to a paste like that, which is $20-$25 off the internet, you can try my recommendations with an over-the-counter sensitivity toothpaste. Think about it like a marinade. The longer you have it on your teeth, the better it will help. I'd recommend, if you have severely sensitive teeth, applying it 2 weeks prior to whitening, and then also immediately after your whitening procedure. If you can hold it on your teeth for longer, as far as putting it in a tray, longer exposure, possibly better desensitizing results, as opposed to just brushing with it. Good luck. Whitening pins are an effective way to whiten your enamel, but they are not the most cost effective. They run about $15 to $45, and essentially you're getting the same thing that you would get in a $1 bottle of hydrogen peroxide. So if you're looking to save money, just buy that $1 bottle of peroxide and brush that on your teeth as often as possible. But if you want something a little bit more convenient, like this is an example of one. It's slender, it's got a little sponge applicator. You can fit it in your purse or your pocket and just kind of hit your teeth multiple times during the day. Some of the solutions have a little viscosity or thickness to them, so you might get better results because it might hang around your enamel longer. And some of them come with a nice flavor like mint or vanilla mint or something hip like that. So just depends what's important to you. Best of luck, everybody. Whitening strips are a very effective way to whiten your enamel and relatively inexpensive. Walmart sells a package of 12 treatments for about $16. Just know that most of the strips on average are about 14% carbamide peroxide, which is a diluted form of hydrogen peroxide. So you're really only getting a slightly elevated amount when you do the math, and don't ask me to convert that for you. Don't watch my math tutor videos, please. But anyways, it's slightly elevated than like what you'd get in your whitening pen, whitening rinse, or just bottle of peroxide. However, the means of delivery, in the sense that it's like a hydrolyzed gel on a strip, will prolong the exposure of the whitening agent on your enamel, yielding you faster results. But it's not custom fit, so it's a little tedious, and you might get more gum exposure to the whitening agent, so you might experience more sensitivity because of that and the slightly elevated level of peroxide. Okay, some whitening tips for you all. If you have whitening products that are not actively in use, such as syringes of gel or strips, keep them in the fridge. I feel like it will keep them activated longer. I just take out whatever I'm gonna use and leave it at room temperature so it will flow easily through the syringe. But after that, I keep it in the fridge because I feel like it will keep the shelf life longer. Another tip is remember, crowns, veneers, and fillings will not whiten. If you already have these and they're whiter than your teeth, then great, you can whiten up to them. But if they're already at the same level or darker, you will see an inconsistency. However, if you plan to replace them, great, go ahead and whiten your teeth. That way your dentist can color match your new restoration to that new white shade that you achieve. Obviously, trying to avoid stain-causing foods and drinks would be helpful in keeping your teeth white. But if you do consume something, if it's a drink, try to consume it through a straw to kind of bypass your teeth. Or minimally just try to rinse your mouth with water if you eat or drink something that causes stain, to get that pigment off of your tongue and out of your saliva so your teeth don't uptake it. But remember, you can help to maintain white teeth by using a paste or rinse containing peroxide, or if you get stain on your teeth, you can use an abrasive whitening paste or charcoal-based paste. My sensitivity tips are on another video, so remember to look at those if you have sensitivity linked to whitening or possibly because of other reasons. One other thing is decalcification. If you have white spots on your teeth, these will whiten brighter, so to get a more consistent look, try using a remineralizing paste like MI Paste 1. Whitening trays are my personal favorite method on achieving efficient, effective white teeth. It's not the most cost effective. However, what I do like about it is that I control the shade of white that I want to achieve and also the levels of sensitivity I'm willing to tolerate, as opposed to getting them whitened in office. My office charges $200. For that, you get the custom trays and 4 tubes of the bleach gel like this. What you want to do is put a thin line of the gel right about in the center of the front of the tray that will lay against your teeth. I only put it on the teeth I'm going to see when I smile, so I don't waste it on my molars. Put it on my teeth, and I squish the gel so it covers my teeth right to the gum line. Do not let it get on your gums. If you do, wipe it with a Q-tip so it doesn't burn. Try leaving your whitening trays on a minimum of 30 minutes. However, if you can go longer, I'd suggest an hour to 2 hours. I personally like to sleep with mine, so the whitening effect takes place while I sleep. I wake up with really white teeth. I'll do that for 1 or 2 nights and get great results, but I can tolerate it. It's not too sensitive. I'd say play around with the minimum time and see what you can tolerate and go from there. When I wake up in the morning, I take my tray out And I run some lukewarm water. I'll rinse the excess gel out and kind of brush it out with my toothbrush. I'll rinse it off of my teeth. And I immediately take some sensitivity toothpaste. I'll get a little dab with my finger, put it on my teeth, and rub it all around. This will help lock in that white shade, help not uptake stain, and desensitize. But if you need a stronger desensitizer, try Mi Paste 1, and you can also apply it in your whitening tray and let it sit on your teeth. Good luck. In-office whitening. At my office, it runs $400. For that, you get the in-office whitening and the custom fit bleach trays with gel to whiten at home, because you do have to touch up to keep that nice white shade you achieve. How often kind of is determined by how white you want your teeth and your personal preference, and also your habits will play a part in that as well. So the pro is that you were whiten one day, you leave with the white teeth. The con is that it's obviously a little bit more expensive, and your risk for more sensitivity is there because it is a more aggressive form of whitening. We do 3 applications of a higher percentage gel, usually 30%, and it's accelerated by a blue light. We read a study showing that the blue light really didn't have an effect on acceleration. However, when we stopped using it, our assistants felt like they weren't getting the same results, so we now use it again. But a side note, those at-home trays with the blue light, I feel like those are a little gimmicky. I'd liken it to an at-home laser hair removal. It's just not going to be the same.